welcome to those coming in. We're just going to give it a little bit of time until we get our numbers rolling through a little bit more, and we'll kick off with our third session soon. Thank you, everyone. Bit slow coming in today. Hopefully we won't be too far off. Okay. Tara, they're a little bit slow coming in. We haven't got many in the waiting room.
No, I think they might just be taking a little while to still come through, but that's all good. I think we can kick it off now.
Okay, no worries. Welcome everyone. For those that have been with us, I'm repeating myself. My name's Gail Easton. I'm the Program Manager for the CDAP program. We thank you for coming, and I'd like to start with acknowledging the rich cultural and spiritual connections of the Aboriginal people here on Wanneroo country where I sit today. And I'd like to respectfully remember the footsteps of the ancestors who have walked this land before us, and for all of those who will follow. So thank you very much for joining us for session 3. I'm going to mute myself and take myself off camera and hand it over to Tara and the lovely ladies from the Matilda Centre. Thank you, Tara.
Wonderful. Thank you so much, Kayla, and thanks again, everyone, for joining us for session 3 today. We've got a lineup of new speakers today that should be really exciting for you all. And before we begin our session today, I'd also like to acknowledge the traditional owners of Australia and recognise their continuing connection to land, water and culture. I'm currently on the land of the Gadigal people of the Eora Nation, and I pay my respects to their elders past and present, and I further acknowledge the traditional owners of the country in which you are on and pay my respects to their elders past and present. I'd also like to acknowledge any Aboriginal and Torres Strait Islanders who are joining us today. Now, I'll just quickly go through some housekeeping points before we get started. So as participants for this session, you are currently on listen-only mode, which means you should just be able to hear and see us. And we are recording this session, and it will be made available to you along with the slides. So you'll get sent those automatically after the session later in the week. And we're also going to have time for some questions at the end. So you should be able to see a question and answer box on your screen there. So feel free to add any questions in there as the session progresses today. And as we've mentioned, this is part 3 in a series that the Matilda Centre for Mental Health and Substance Use is delivering for the CDATs. And today's session is going to be looking at primary prevention in action. So we're going to be focusing on 3 prevention programs that are developed here at the Matilda Centre. And you're going to be hearing from 3 different researchers as well from the Matilda Centre. And now an outline for today's session. So you'll see here that the 3 programs that are going to be covered are Climate Schools, Health for Life and the Illicit project. And we're going to be touching on a few things within the program. So what the program is, who it's suitable for, and what the content in the program covers, and sort of some outcomes of the program and how it's being evaluated or tested in research studies. So first of all, I'd like to hand over to Dr. Lauren Gardner, who's a research fellow at the Matilda Centre, and she's going to be discussing the Climate Schools program.
Thanks, Tara. I will share my slides. There we go. And okay. Great, thank you so much for having me. So yeah, as Tara said, I'll be giving an overview of climate schools in this session. And just before I jump into the presentation, I'd like to acknowledge the many wonderful people at the Matilda Centre and beyond who've contributed and continue to contribute to the development and dissemination of climate schools, particularly Marie Thiessen and Nikki Newton, who are the founders of Climate Schools. So in this presentation, I will provide an introduction to climate schools, give you a bit of an overview of the evidence from our trials, as well as some of the external endorsements of the program and how the research has now influenced policy. We'll then explore the impact in terms of current reach within Australia, how we're now reaching international audiences. I'll provide a case study from a school who's used the program in Australia before going on to some of our recent updates as we refresh and relaunch as our futures. So firstly, what is Climate Schools? So Climate Schools is a universal evidence-based prevention education program for secondary school students, aiming to empower them to make positive choices to improve their health and well-being. And by universal, I mean it's delivered to all students in the classroom, regardless of their level of risk. So the program currently consists of 5 curriculum-aligned modules, and so they've all been developed based on the best available evidence and co-designed with students and teachers. The first module is the alcohol module, so that was developed back in 2002 for Year 8 students. Then came the alcohol and cannabis module, which aims to act as a bit of a booster for the alcohol module and then transfer those skills onto the alcohol and onto cannabis. Then came the cannabis and psychostimulant module, which is for Year 9 and 10 students. And that can also be run with Year 11 students as a wellbeing initiative once health education becomes an elective subject. That was followed by the ecstasy and emerging drugs module. And then most recently, we released the mental health module. And so that one's aimed at students in Years 8 to 10, and it's ideally delivered alongside the alcohol and cannabis module. So all of the modules are ideally delivered sequentially, but they can also be delivered individually. So each module is structured as 4 to 6 lessons, with the main component of each lesson being these interactive cartoon storylines. And these are all grounded in social influence theory. So they're using characters who are around the same age as those target students, which allows us to deliver peer-led messages, which we know are more effective at driving behaviour change than having the messages come, from an authority figure like a teacher or a policeman. And we also touch on topics such as love interests and teenage dramas to really engage the students. We also have short quizzes and activities that are embedded within the cartoons to consolidate knowledge and just ensure that students are engaging with the content as they go. And then after completion, students get a summary sheet for each lesson to reinforce the content. And then the second part of the lesson involves teacher-facilitated activities. And we offer a range of different activities to let teachers choose if they have different preferences for a certain delivery format or a different amount of time to prepare. So we've got things like worksheets, class discussions, and role plays. And teachers can also access their own lesson summaries. And we've got links to syllabus documents available and online implementation guides as well. So no formal teacher training is required. So to date, we've conducted 8 randomised control trials to evaluate the effectiveness of the programs. So 6 of those are complete and 2 are currently underway. But overall, this has included 240 schools and over 21,000 students across Australia. And we've published on these trials in 42 peer-reviewed papers in some of the leading journals in our field. We also ran a pilot trial in London, which found climate schools to be feasible and acceptable in the UK context. But I'll go into the international translation a little bit more in a moment. So in terms of results, across our trials, we've measured a wide range of outcomes, but some of our key findings included demonstrated effectiveness in increasing knowledge about mental health, alcohol and other drugs, reducing alcohol consumption and binge drinking, reducing cannabis and ecstasy use, slowing the progression of anxiety and reducing psychological distress, reducing harms from substance use, reducing intentions to use substances, and improving attitudes towards alcohol. And so all of those findings are compared to our control groups, which received their health education as usual. Additionally, students found the cartoon stories to be an enjoyable and interesting way to learn. They felt that they were easy to understand and remember, and teachers highlighted the high educational quality of the program, rating it more favourably than other substance use and mental health programs. And in addition to our own publications, the Climate Schools trials have been cited in a number of independent reviews, including 2 Cochrane reviews that examine the effectiveness of drug prevention. And in one of the more recent reviews, Climate Schools was highlighted as one of only 3 alcohol education programs with good evidence of effect. Climate Schools has also been endorsed in a range of national and state-based resource directories, such as the ADF and BU, as well as by some key education authorities like the New South Wales and South Australian Departments of Education. And the research has also translated into policy, informing both national and international prevention policies and practices. So for example, it informed the 2015 and 2018 International Standards for Drug Use Prevention, which is produced by the United Nations Office on Drugs and Crime, as well as the World Health Organization. Last year, we produced an expert submission for the Queensland Mental Health Commission on best practice in AOD prevention. And earlier this year, we participated in a review of the Australian Health and Physical Education curriculum for ACARA. So where to next? So we've continued following up some of our study participants in long-term trials over about 7 years. So those participants are now in early adulthood. So for example, we have the CAP study, which integrated our Universal Climate Schools programs with a selective prevention program to prevent substance misuse. We had the CSC studies, which evaluated the combined approach of the mental health and substance use modules. And we also have some new trials that I mentioned are underway. So still building on that original Climate Schools model with those interactive cartoon storyboards as the core component, but extending into new domains. So we have Climate Schools Plus, which combines a parent component with the original Climate Schools alcohol and cannabis modules. We have the Health for Life initiative, which Katrina is going to talk to after this. So I won't go into that now. And we also have Strong and Deadly Futures, which is the first school-based alcohol and other drug prevention program specifically for Aboriginal and Torres Strait Islander secondary school students. So the idea is that once we have established that evidence of effectiveness, these new programs will then be able to be offered more broadly within that suite of Climate Schools programs. In terms of impact, so at the moment, there are over 1,100 schools and organisations registered on the Climate Schools website. So with a range of other types of organisations as well, such as LDATs, health services, government departments. Previously, we had a modest fee for service model where schools would pay a subscription fee for access based on the number of students at the school who'd be using the program. But in response to the challenges that schools were facing during COVID, we've made the programs available free of charge, and we've had quite a surge in registration. So over 600 new schools or organisations have taken up the offer since March last year, that was. So it's been really wonderful to be able to help schools in that way and just provide them with a program that can be easily accessed, whether they're in times of school-based or home-based learning. And yeah, you can see here we ended up with schools in every state and territory of Australia taking up the offer, which is just amazing. So in addition to the Australian website, we also offer adapted versions of the materials for the US and the UK. So these differ in terms of things like the definitions of standard drinks, when we talk about local laws or refer to different alcohol brands. So they've got their own separate websites. I think we've got around 100 schools across the 2 sites, but they only offer the first 3 substance use modules, and they've always been offered free of charge. Additionally, we've had interest from a range of other international organisations and institutions. And so we've commenced collaborations with the likes of New Zealand, Hong Kong, Zimbabwe, Ireland, and Germany. For example, our New Zealand partnership was with Education Perfect, which is the biggest provider of online learning for a range of subjects across both Australia and New Zealand. So they kind of position themselves as a modern day alternative to textbooks. And they've got thousands of schools registered. So last year, in response to the challenges that schools were having in the pandemic, they created this student spotlight initiative where wellbeing content was made available to all of their schools. And we partnered with them to create a one lesson knowledge and skills building lesson on mental health. And so that was all based on our 6-lesson mental health module. So it kind of had just snippets from the cartoons and some of the exercises around thought challenging, realistic thinking and help seeking. And we provided 2 versions of the program, so one for Australia and one for New Zealand, and that went out to all of their member schools. And we had a great response. So out of all of the student spotlight programs on Education Perfect, our program was rated the highest quality in New Zealand and 2nd highest quality in Australia by students and teachers. Our Hong Kong partnership is with Keeley Support Group, which is a youth organisation in Hong Kong, as well as the Chinese University of Hong Kong. So they're working with young people and local illustrators to adapt the Climate School's alcohol module to suit their local context and translate all of the materials into Chinese. So you can see here is an example of the adapted cartoon. So the 2 on the top are the Australian cartoon, which has a scene where the young people are drunkenly playing in a shopping trolley and rolling each other down the street. But that wasn't considered something that would happen in Hong Kong. So to make it more believable and realistic, they updated it to young people drunkenly dancing and singing on the MTR, which is the Hong Kong rail service. And this is just another example. So it's a house party in the Australian cartoon, and that's been updated to a karaoke bar for the Hong Kong version. So they're going to adapt to trial that adapted program with 25 schools before it will hopefully be rolled out more widely if it's found to be feasible and effective there. So Tara mentioned that in the last webinar, there was some interest in hearing about a case study of a school that's implemented climate schools. So I thought I'd tell you about the work that Substance Misuse Limestone Coast LDAT has done, because they ran climate schools and put an interesting spin on it. So the Limestone Coast area is in South Australia in Mount Gambier, so on the coast between Adelaide and Melbourne. And they had identified higher rates of risk-taking behaviour among young people due to reduced access to health services, education, employment and recreational activities. So they aimed to establish a collaborative, evidence-informed community model to address AOD use issues in the area, including best practice AOD education in schools. And Climate Schools was their program of choice, not only because of the significant evidence base behind it, but because they felt it would be really easy for them to deliver. So they aim to deliver the Climate Schools program across a range of outer regional schools in the Limestone Coast. But to begin with, they supported one school, Tennyson Woods College, to pilot the program. And they did this through a Year 10 leadership group. So the Year 10s received some training to help them kind of increase their confidence in their ability to communicate with others. And then they themselves completed one of the Climate Schools modules. They then went and formed small groups and came up with a plan for how they would assist teachers in the delivery and really get the Year 9 students, so the cohort below them, on board by acting as peer supporters. So there was about 160 Year 9 students across 5 classes. And in some of the classes, they had each student work through the lesson on their laptop before facilitating the kind of discussions and activities together as a class. Or in other classes, they just used a smartboard and they had the kind of whole class follow along, and sometimes they did little role plays where some students would read out the lines for certain characters. So the full Year 9 cohort successfully completed the module, and they were given completion certificates that you can see in that photo. And the program got some great feedback. So you can see here a student said, "Climate Schools is really good. I really like it. Good characters and good stories. It's not dorky." The teacher said the Year 9 girls have loved it and have really engaged with it. as part of the backup activities, we asked them to plan a party, and on their invites, they have made it clear it's alcohol-free. We're going to continue with it. It's so easy to use and prepare for. And the principal said it provided a leadership opportunity for our students, and the fact that it wasn't one of us that delivered has been a real positive. So not only did the Year 9s get that benefit of the AOD education, but then the Year 10 group got kind of extra exposure by delivering it and awareness, as well as increasing their confidence in presenting and facilitating discussions. And so because of this great feedback, the program was written into the school's curriculum for the following year, and Substance Misuse Limestone Coast supported other schools in the region to start using the programs. But I believe that they kind of just went with the regular sort of delivery, which is how it was trialled. So we know it can similarly have great benefits. But I just thought this peer supporter method was quite an interesting take on the program that was worth sharing. And then finally, just some of the top tips for implementing climate schools that came from Substance Misuse Limestone Coast. So to find a passionate school leader, because if you don't have a champion on board who will make it happen, they've found that it can be quite difficult to get it off the ground. To ensure that all teachers know about it and, if possible, ask to attend staff meetings and kind of get it onto the school agenda in minutes. And to plan early. So due to the tight timeframes associated with planning an annual curriculum, schools really need to be engaged to plan for that delivery of climate schools, sometimes towards the end of the school year, so they can include it the following year. Okay, and then finally, the last section is on scaling climate schools. So given a lot has changed since Climate Schools was first developed and named about a decade ago, we're excited to announce that we'll be rebranding and relaunching as Our Futures next year. So we're currently in the midst of a big refresh and upgrade of the website and the materials, and we're hoping that this will allow us to take the program to scale to empower more young people to improve their health and wellbeing. So for example, some of the updates, we went through all of the scripts, the summaries, the activities to make sure that they reflect the latest health guidelines and statistics. We've updated the cartoon imagery. So we've incorporated things like more modern clothing, different hairstyles for the characters, as well as increasing diversity and reflecting new technologies. So you can see here we were a bit outdated with the landline phones, and we've switched those now to FaceTime or Snapchat conversations. We conducted a survey with our youth advisory board and some young people in our networks around the colloquialisms that we used in the script, and we got some useful feedback, like pills should actually be updated to caps, ecstasy should be referred to as MDMA, you know, dance parties should be a rave, but apparently hooking up is still hooking up. During some other focus groups, students said that they wanted to know more about the characters' backstories. So we created these character maps to show the relationships between the characters and explain their backstory. And those are now embedded at the beginning of the first lesson for each module. And we also worked with young people to cast teenage voice actors to record voiceovers for the cartoons. So this allowed us to increase accessibility for lower literacy or vision impaired students. So I'll just play this one.
This party sounds massive. You can hear the music all the way down the street.
Yeah, Luke's DJ friend bought his decks and speakers.
Yeah. And we've also included some fact checks to ensure that the cartoons are always reflecting the most up-to-date statistics, despite having those voiceovers recorded. So, you know, we had to consider what was being said in the voiceover, given statistics change over time, and we then need to have them re-recorded. And, you know, the voice actors may have left or their voices changed, as they do when they're going through adolescence. So we decided to instead make the statements that they say a bit more vague, and then we'll have these fact checks there to give specific statistics. And this also allows us to meet syllabus outcomes around health literacy. We have redesigned some of the worksheet-based activities to make them interactive. So they can either be assigned by the teachers as just activities where the students will get immediate answers and feedback, or they can be assigned as assessments where the teachers have sent the students' responses to mark. And so then they can go into their new marking centre to do so. And teachers can also access a teacher discussion board. So with teachers either from their school, but also other schools can go in and they can share resources or discuss materials, and they can go in and comment or like others' posts. And the new website also increases accessibility by allowing for a screen reader and translation tool. So currently over 20 different languages we can get from that. And finally, relevant to CDATs and LDATs and any other organisation that might be wanting to facilitate registrations for multiple schools, we've added a function that allows a contact to be across multiple school accounts. So previously they could only register within one school, but now they can go in and they can switch between schools to view registrations or student progress, organise payments, do all of that, but on different school accounts. So the plan is to launch the new site from the beginning of next year, and it will remain free of charge in terms 1 and terms 2. So teachers and organisations have that time to adjust to the new site and test it out without having to worry about payments then. So yeah, stay tuned as we move towards the launch. You can sign up to the Our Futures mailing list by visiting the website, or feel free to get in touch if you have any questions. Thank you.
Thanks, Lauren. It's always so great to hear about climate schools, and exciting as well to see the Our Futures launch and all the changes that have been had with the new website. And now I'll hand over to Dr. Katrina Champion, who's a Senior Research Fellow here at the Matilda Centre and going to be talking about Health for Life.
Thanks, Tara. I'll just pull up my slides. Okay, so I'm going to spend the next 10 minutes or so talking about the Health for Life initiative, which is very much based on the climate schools model that Lauren just spoke about. But this program in particular is designed to prevent the big 6 risk factors for chronic disease. So what are the big 6 risk factors? So these are recreational screen time, so time spent sitting down, watching TV, playing video games, using your phone or other electronic devices, poor sleep, physical inactivity, poor diet, tobacco use, and alcohol use. And we know that these behaviours are highly prevalent among young people, both in Australia and right around the world. We also know that they track into adulthood. So this means that a young person who might be physically inactive as a teenager is also more likely to be physically inactive as an adult. And they're linked to a whole range of different poor health outcomes. So these include things such as an increased risk of obesity and mental health problems during adolescence, as well as increasing the risk of chronic diseases such as cancer, type 2 diabetes, heart disease across the life course. And one of the key things that we know about these big 6 behaviours is that they commonly co-occur. So to help illustrate this, I thought I'd just go through a bit of a profile of Hamish, who's a teenage boy. So Hamish is in year 7. He's obsessed with playing video games and doesn't have many other hobbies. His current physical activity levels are very low, but he used to enjoy playing basketball at primary school. He often goes to bed very late after he's finished gaming, and he wakes up feeling tired and groggy the next day. He's sleepy throughout the day at school, and he struggles to pay attention in class. His mum has noticed that his mood has been quite low lately, and he's not performing well at school, and she's concerned. So here you can see that Hamish is engaging in multiple risk behaviours at the same time. So he's got high levels of screen time through playing the video games. He's got low levels of physical activity, and he's also sleeping poorly. And then we can also see that this is going on to potentially impact his mental health. So he's having some problems with his mood, and it's also impacting his performance at school. And when we look at data among young Australians, so looking at our baseline data from the Health for Life study, which is among more than 6,000 young people, in fact, nearly 2/3 of young people said that they engage in 3 or more behaviours at the one time, and about 1/4 said they engage in 4 or more behaviours at once. So rates of this multiple or co-occurrence of the big 6 is really high among teenagers. And this is particularly concerning because having these multiple unhealthy behaviours increases the risk of a whole range of negative things, including increased risk of chronic disease and premature mortality, and as well as increased risk of depression, anxiety, and psychological distress. So this has kind of formed the foundation, I guess, for what we call multiple health behaviour change interventions. And these are programs that target behaviours together rather than on their own. Without going into too much detail, they're grounded in transfer theory. So the idea here is that new skills and knowledge that facilitate change in relation to one behaviour might be transferred to another context or behaviour. So resulting in this tag-along health behaviour change without additional effort. So the idea is that they're potentially more efficient because you're targeting multiple behaviours at the one time, more cost effective in terms of needing to expend less resources, and potentially more effective in terms of promoting behaviour change as well. So that's the approach that underpins the Health for Life study. So it aims to adopt a multiple health behaviour change approach to prevent those big 6 risk behaviours among teenagers. And there's a few different components that I'll just run you through now. So the first is the school-based program. And so this is very much modelled on the climate schools programs that Lauren presented, in that it includes 6 20-minute modules delivered during health education classes. This module is specifically designed for Year 7 kids, and they're delivered via web-based cartoons about a group of teenagers. Hamish, that we met earlier, he's one of our characters in Health for Life, and we use him to kind of deliver prevention messages around screen time and sleep. So what does it do? So it aims to provide evidenced information about the big 6, and then to improve resistance skills, modify existing norms, and increase autonomous motivation. It includes these stop and think activities to promote critical thinking, so encouraging students to stop and reflect on what the characters are doing and how they might apply those situations to their own lives. Like climate schools, it includes quizzes, student summaries, teacher summaries, and optional class activities. And it also includes this web-based tailored feedback, which is a new component that hasn't been included in any of our other programs. So students receive colour-coded feedback about how well they're adhering to national guidelines. And then they're then given some strategies and tips to either improve or maintain their behaviours. Oops, sorry, I think I've got a bit of a delay on my slides here. Okay, sorry about that. So in terms of where we're up to, so we're running a cluster randomised controlled trial among over 6,000 young people from 71 schools to evaluate the program. And the aim is to compare it to usual health education to see if it's more effective in reducing or modifying those big 6. I don't have any data to present to you at the moment because it is still under trial. It started in 2019 when students were in Year 7, and then they've then completed the program and completing annual follow-up surveys with the 24-month survey underway at the moment. But what I can present is some feedback from students and teachers. So we had about 2,000 students provide feedback on the program. You can see that the vast majority rated it really positively, so only 5% thought it was poor or very poor overall. 88% felt that the skills and information in the program would help them to be healthy in the future. Lots of positive quotes as well. So the main themes were that they thought the cartoons were fun, they were an engaging way to learn. Someone thought it was inclusive, and also some comments about actual behaviour change, that the program actually encouraged them to think about their own health behaviours and to make changes in their own lives. We also had teachers evaluate the program, and again, it was pretty positive overall. So 84% thought that the program was good or very good, and nearly 2/3 said that they would use the program in the future. And I just thought I'd finish up with this quote here on the screen, which is from a teacher in New South Wales. So they said, "I had a light bulb moment last night at parent-teacher meetings. One of the mothers was telling me that their son had completed the Health for Life survey and was told in the feedback section," so that's that web-based tailored feedback that I briefly touched on. So they were told in the feedback section after the survey that he was on the screen too much and that he should do something about it. The boy then, on his own accord, put things in place to reduce the amount of time he was on the screen. When the boy told his mum why he was doing it, because she had been telling him for years with no luck, she was full of praise for the Health for Life initiative. I wish I could communicate the look of gratitude on the mother's face. It made my night." So I think that's just a really nice example of the potential of the program to actually promote behaviour change and have an impact for both students and their parents and teachers, I guess. So just to finish up, so what can CDATs do? So the first thing would be to promote Health for Life to schools. So it is still under evaluation at the moment, as I mentioned, but it will be available at the end of next year. The best way to stay up to date on where things are at is to sign up to our mailing list on our website. And then some other kind of takeaways would be to consider adopting a multiple health behaviour change approach to prevention. So as a reminder, that's thinking about targeting risk factors together rather than in isolation. And to consider taking a healthy lifestyles approach to alcohol and other drug prevention and mental health promotion. So by this, I just mean thinking about promoting good sleep, healthy diet and physical activity as a way of preventing and or reducing alcohol and other drug or mental health problems among young people. So I just wanted to briefly acknowledge all the wonderful people that have been involved in the study, our team of researchers, our funders, and of course, the many young people and schools that have taken part in the study. So if anyone has any questions, feel free to pop them in the Q&A box. Otherwise, feel free to send me an email or visit our website for more information. Thanks.
Thanks, Casey. It's always so great to hear about Health for Life. And I loved that little case study and quote you included from the teacher at the end. I think that's every researcher's sort of dream, feedback from a program. And now I will pass on to Dr. Jennifer Debenham, who's going to be talking about the Illicit project. So over to you, Jen.
Thanks, Tara. Alrighty, so I'll be talking about the Illicit project, which is a neuroscience-based harm reduction program for older adolescents. Okay, so why target older adolescents? So in 2019, the age of first-time alcohol use was 16.2, and the age of first-time illicit drug use was 19.9. And this represents an almost 2-year delay from the age of initiation around 2 decades ago. So that's to say the current generation of young people are waiting longer to first try alcohol and other drugs. And this is just a graphical representation showing that illicit substance use really starts during this older adolescence period from around 16 to 19 and into early adulthood. So despite older adolescents being this new age of initial experimentation with alcohol and drugs, there's actually no mandatory curriculum for senior secondary school students. And similarly, there's very few programs targeting this age group. So this prevention gap is leaving this group of senior school students to navigate quite a complex environment when drug use is becoming, more and more normal, however, with very little support. Now, this is quite concerning because we know that the brain is undergoing major structural integration up until the age of 25 years. So what you can see in this image is a picture of 3 regions of the brain. And in a very simplified sense, the brain develops from back to front. So it starts at the hindbrain with those automatic, quite I want to say simple, but more basic survival functions. So that's like heart rate and breathing. Those functions develop first. Then you've got the subcortical midbrain. So this is home to the pleasure center and the fight or flight. And then finally, the last region of the brain to mature is the prefrontal cortex. And it's responsible for higher level thinking and executive functioning. And what this is, these are your skills like your planning, judgment, decision-making, and self-regulation. So the prefrontal cortex is thought of as the CEO of the brain because it manages all the other areas of the brain to make sure no area falls out of step. Now, because the prefrontal cortex is undergoing rapid change during older adolescence, neuroscientists think that it's more vulnerable to the negative impacts of substance use. So this is a rapidly evolving area in neuroscience and represents one of the big risks for young people using substances. However, the developing brain also holds a lot of opportunity, and that's due to its high level of neuroplasticity. So neuroplasticity is the brain's plastic, malleable quality that enables it to grow and change based off our experiences. So in this GIF, what you can see is you can see brain changes occurring from age 6 to 20, with the warmer colors indicating less developed areas and cooler colors indicating more developed areas. So basically the brain changes a lot over childhood, adolescence, and also into early adulthood. And essentially what's going on in the brain is, you know, we're born with this massive number of jumbled neurons that we don't necessarily need. And over time, our brain tosses out what it no longer uses and starts to organize and strengthen the connections and the synapses that it uses the most. And this is called the use it or lose it principle and underpins neuroplasticity. So essentially, there's this opportunity for young people to rewire, to retrain, and essentially grow their brains, for example, to improve their memory whilst they're young. And it's this really exciting phenomenon that can be used in drug education because it's not just about simply avoiding the harms associated with drugs, but it's also about moving towards growth and a strengths-based mindset. So welcome to the Illicit Project. So these discoveries in neuroscience and these changing trends in young people were the impetus to develop the Illicit Project. So it's a neuroscience program and it aims to upskill older adolescents in harm reduction strategies. So I'm going to frame the next part of my talk around the development journey of the illicit and where we got to, where we're at right now. So back in 2018, I co-developed a face-to-face version of the Illicit Project. And the first point of call was to, the start of the journey was to pilot some of these ideas with young people. So in 2018, towards the end of 2018, I ran a pilot study, and it actually was the first study of my PhD. And along with some other trained young people, I went into schools and I also delivered the program to the North Shore CDAT, bit of a blast from the past. And yeah, we went in and we delivered 3 workshops to young people to pilot some of these ideas around neuroscience and harm reduction. So I had 9 CDAT members provide feedback. We visited 2 schools and 1 youth centre. And we were trying to assess the feasibility of the program in schools and youth centres to explore the credibility and the acceptance of the program among teachers and young people. And then finally, we wanted to look at the preliminary efficacy of the program and whether it changes, you know, whether it increases drug literacy levels among young people. So during the evaluation, we found that the majority of students agreed that the neuroscience was interesting, it was relevant, it was engaging, and that they were going to, they planned on applying it in their own lives. The large majority of teachers rated the program as good or very good. They recommended, they claimed they'd recommend the program to other teachers as well. And excitingly, we found there was a significant increase in drug literacy post-program. So drug literacy is this this term that I've coined, and it's around the knowledge and the skills required to effectively identify and then minimize the harms associated with substance use. So I've got some quotes of feedback from the teachers and the students, and I've just picked a bunch that summarize the key themes that came out of the pilot. So teachers said that the neuroscience statistics and facts reinforce the content and made it more believable. It doesn't preach what people should or shouldn't do. It puts the individual in the driver's seat and seat over decision making. Because the prevention style was relaxed and the information was quite conversational, it fitted well within a youth centre setting. The non-judgmental approach was effective in engaging students, and the interactive content and trick questions got them thinking. And now from the students, some said, I really enjoyed seeing the effects of drugs on the brain. Others enjoyed hearing the thoughts of their peers through the open conversations. But then the two middle ones are those that people were less keen on. So when we presented too much information, one student suggested using videos. Another student said, oh, it got a bit repetitive at times. Other students enjoyed the friendly presenters. It didn't feel like people were being judgmental. And breaking into groups with the researchers and discussing work was another favourite part of the program for students. So this was really exciting because we knew that the program had a lot of potential, and then the core components were working and, were engaging and credible, but we knew that there were a few wrinkles still to iron out. So we refined the core content of the program, and this is actually the pilot study is written up in a publication submitted to BMJ Open if you'd like to read more about that. But essentially the key components of the program are the psychosocial approach, which I'm sure everyone is well accustomed to. So we all know that knowledge provision, normative education, so encouraging, reminding students that, not everyone uses, in fact, most people don't, and increasing that normative understanding of prevalence, and building self-efficacy to resist peer pressure. So we know that approach really works in driving behaviour change around substance use. And then this program is different in the sense that it looks at harm reduction. So we're looking at preventing, delaying, reducing use, but also really reducing harm. And that's a real focus of the program, is looking at the harms that, change across all individuals and how to really identify and minimize those. And we also include neuroscience. So some of the key values of the program are its non-judgmental approach. It's science-based, so we've got neuroscience, we've got the latest census data. It's a lot of facts, I suppose. And the aim is to inspire young people to actually care about safety and to respect their brains. And then to empower young people to seek out options during tough times, so to get help when need be. So the next stage to improve the scalability of the program and to increase access and enable more flexible implementation in schools and in a community setting was to transition the program online. So the first step was to rally together this group of experts and young people to inform the development of this online version of the program, and that occurred over 2019 to 2020. So what's really essential to the success of the program to date has been involving young people every step of the way. So from initial ideation and concepts to prototyping and script writing, we've engaged members of the Premise Youth Advisory Board, which is hosted by the Matilda Centre, which is a group of incredible young people from all over Australia. We've included drug experts, neuroscientists, researchers, and a convenient sample of young people. And this was an extremely iterative process. And the fun thing is that all of these experts are under 30. So the program really aspires towards that peer-led approach. And the development and the adaptation of the program online has been written up in this publication, submitted to Contemporary Clinical Trials, if you'd like to read more about that process. So after ongoing revisions over about a year and a half, we developed a program that aims to reduce risky substance use and related harms by upskilling young people in harm reduction and drug literacy skills. We aim to leverage positive psychology and strengths-based learning to inspire young people to respect their brain. And we want to engage young people through positive peer role modeling so that they can better navigate these complex social situations. So finally, I'm going to show you a little bit, I'm going to show you the online program. So essentially to access the program, you log in through this URL and you type in your name and your password, which have been pre-registered by either myself, or I'm actually currently developing a feature so that teachers or community members can self-manage student registrations. And then this is my profile. You can see I've got my name at the top, and you get access to these 3 online modules. Each runs for about 30 to 40 minutes, and there's a corresponding worksheet. So we've got Module 1, Alcohol and the Growing Brain. Module 2, Cannabis, MDMA and Harm Reduction. And then Module 3, Mental Health and Wellbeing. So you can't start one module without completing the previous one, and there are some points and features within each one to gamify the process a little bit. So workshop 1. So on the left-hand side, you can see a variety of the animations, some of the interviews with young people, some of the widgets or the plugins and the interactive activities, and then also some of the case studies. And then we've got the corresponding worksheet associated with workshop 1. So essentially we examine what makes the adolescent brain different to an adult's brain. We look at alcohol's journey through the body and neural mechanisms behind intoxication. So really linking levels of intoxication with the parts of the brain that alcohol is affecting. We engage young people in critical analysis around how many young people really drink and why we think these trends are occurring. We practice harm reduction with alcohol through case studies and goals and planning, lots of strategies around that. And then we appreciate the power of neuroplasticity and how to play to the strengths of the developing adolescent brain. Workshop 2, so this is MDMA, cannabis, and generally recreational drugs and harm reduction. So we define society's perception of danger and risk to the individual and risk to the society. So through this setting drug framework, we assess how the concept of risk is quite subjective and how it changes across individuals. We explore the short and long-term impact of cannabis on the brain, and you can see in these animations we've got THC, how it mimics anandamide, the body's naturally occurring cannabinoid, and we follow that journey of THC through the body and into the brain. Similarly, in the animation above, that's MDMA at the synapse and how it actually causes an increase in serotonin and dopamine and noradrenaline. And we really link those molecular changes and the mechanism of action of the drug to the individual's experience of intoxication. So we assess the short and long-term impact of cannabis and MDMA. We examine the recent inquest into MDMA festival deaths, and we practice harm reduction, and all of those activities are then also in the fact sheet or worksheet after the online component. Finally, we have workshop 3, and this looks at addictive behaviours and mental health. So investigating factors that influence addictive behaviours, exploring the underlying reasons behind repeat drug use and the why behind someone's decision to take a drug, and then navigating complex mental health situations, including how to support friends going through tough times and how we need to be supported through tough times as well. So we really make that link between substance use and risky substance use and mental health. And next, so after many iterations and a lot of refining and review of the program, it's finally ready. Back in 2020, it was finally ready for a randomized controlled trial. And this is where we wanted to evaluate the program's impact on behavior. So the general aims of the RCT were to, our general hypotheses were to compare how Illicit, the Illicit project changes substance use, knowledge and skills, and willingness to seek help compared to the control group. So we had 950 students from across New South Wales partake in the RCT, and that started at the end of last year. We're very excitingly about to publish our 6 months results. However, I don't have any to share with you right now. Due to COVID, there were some issues with missing data. It was very tricky to engage students. So we've got some really, really promising results, but we're still analysing them to understand the impact of missing data. So I'm hoping to share those results soon. So in summary, the neuroscience-based harm reduction approach taken by the Illicit project is feasible with teachers and students. It was credible and it was really well received. There was preliminary evidence to suggest that the Illicit project is effective in improving drug literacy levels, and the broader effectiveness of the program is currently being trialled and tested. So results to come. In terms of next steps for the Illicit project, so we're really exploring other implementation and delivery styles. So we want to look at condensing the program into, say, a 1 or 2 part program for Year 12 students who are time poor, or perhaps youth centres when there's less of a structured learning environment. And we're really trying to develop a program or a product that is fit for purpose, whether it's within the school environment or within the community. So we're actively at the moment looking to develop a team to help us refine and cut and paste and tear the program up a little bit to see how it can better suit the needs of students outside of the school environment as well. So currently the program can be implemented in settings outside of the school in New South Wales, however not in schools at the moment, just whilst the trial is ongoing. The program can be implemented in schools in states outside of New South Wales. And at the end of the trial, so in October next year, we'll be able to open up the program to all schools in New South Wales. So in terms of CDATs and how our kind of goals and missions align, one thing that a few things that you guys can do in your CDATs is to promote the program to schools. So it is available to all schools as of next year. So good to get in early and start those balls, get those balls moving before the time the clock ticks around, to promote the Illicit project in community settings. So it is available to youth centres and TAFEs or other settings. To advise on implementation styles. So it'd be great to hear some of your thoughts on what you think, how the program can be adapted and, changed to fit different settings. And then finally, to adopt neuroscience teachings and harm reduction strategies in your prevention initiatives. And finally, I'd just love to thank my amazing research team. So my 3 incredible supervisors, Nicola Newton, Louise Birrell, and Katrina Champion. And yeah, feel free to flick me a note via my email there or follow me on Twitter. Or if you'd like to find out more about the program, we've got the website there that we're looking to build up. And that is a wrap. Thank you so much for listening.
Thank you, Jen. I think everyone needs to know as well, you did so much of that during your PhD, basically all that body of work, which is a huge effort, amazing for the 3 years of your PhD. I can see you're getting a few questions come through via the chat and the Q&A. I know, Gail, did you want to, I'll hand back over to you now and you can sort of go through and can direct questions to Jen, Katrina or Lauren.
No worries. Thank you so much, Tara. And thank you, ladies. It's so informative. And I know that the layers of information that keep being provided to ourselves and those that are in the CDAT program, we really value it, particularly from that young people engagement as well of how is it that we can support them. And I love the language. One of the things that was said, and I'm pretty sure it was you, Jennifer, was around, and forgive me if it wasn't, respecting the brain, young people and respecting the brain. That's something that we know they can be a little bit laissez-faire about that in their world. So it's really great in and around that language and the levels of what the programs actually go to. One of the questions that we do have is in relation to health for life. Can the program be adapted in the future to run out of youth organisations? Sometimes engaging with schools to take on a program, they're not mandatory and it can be difficult. And you did reference that throughout that as well, is that engaging with schools, you need to get in early. So I'll hand that over of whether or not it can be adapted.
Yes, I forgot to mention that the Health for Life program is aligned with the New South Wales PDHP syllabus and the National Health and Physical Education curriculum. So it does kind of tick off a lot of the syllabus content around, health and wellbeing. But I think certainly as we move into the implementation phase for Health for Life in 2023, some of the things that Jen touched on, we would definitely be open to working with youth organisations to hear how it could be implemented in contexts outside of the school setting. Because ideally, we do all this work to develop a program and trial it, and we just want to make it available to as many young people as possible.
And Katrina, please let us know how we in the CDAP program, the community development officers, can support the CDATs in that space also. We would love to be a part of that journey with you and spread the word. Another question that we've got within the chat are the promotional packs and resources. Are they available to CDATs to use and to directly take to schools, youth centres and the like, so that they can talk to those people about it and look to engage?
Do you want to comment on that, Lauren, or maybe the availability of the climate schools programs through our futures?
Yeah, so we can certainly send out some brochures. We've got some of those that we've recently had redone in all the Our Futures branding and got all of that information. So we could send that out. We do have some for Health for Life as well. And Jen, I'm not sure what you have for the Illicit project.
I have I'd be happy to send out the information pack, which is, just a PDF kind of flyer, and that has all the information of the program and upcoming activities. And then there's also the website, which has also got a lot of up-to-date information, I think, for all three of the programs, which might be handy as well.
Links have been populated in the chat, so I encourage those that are here with us online to copy those links over and pop them into your browsers. Perhaps just flag them as a bit of a favourite, so then you can have a look and go back at them also. Another question that we've got is, how long do the modules take to complete within the Illicit project?
So the three modules, they all go for about 30 to 40 minutes, and there's just that bit of flexibility there because there are a few interactive components to it, which can take a little bit of extra time for some students. So the online component is about 30 to 40 minutes. And then we've got the worksheets as well. And they kind of go for the remaining of time in the class, so about 15 to 20 minutes. But there's a little bit of flexibility should there not be enough time for the worksheets. They're not essential, but they do just kind of reinforce a lot of the core components of the program. So all up I aim for about 50 to 60 minutes.
Which is an achievable learning module, really. It's not too long. We're not going to get too tired by it, but the opportunities to learn and carry that information and data with us is fabulous. So we have another question for, when is the next, or Tanya, Nsdhs survey, as the one that you referred to, Jen, was in 2019. It'll be very interesting to see how the results have changed with the COVID impacts. Totally agree with you there, Tanya. I'm really interested to see what sort of results we get in changed behaviour, whether it be up, down or neutral. Does anybody want to comment with regards to the next Nsdhs survey?
I think they're about every 3 years. I think the previous one to that was 2016. I'm not too sure about that exact survey, but I don't know whether there will be any delays due to COVID. I know with the ASAD, which is the Australian Secondary School Survey, they had to postpone for a little while due to COVID. So I'm not sure if it will be the same.
I think there'll be certainly some interesting data that comes out that some we might not be surprised from, and others might be quite either an uptake or a downturn in those areas. I have a question in regards to the climate schools. You've made mention that the cost to schools has actually been removed. Is there, and what you said is that moving into our futures, that there will be a fee in the future. What sort of fees do schools incur in order to engage in the climate schools program?
Yeah, sure. So the plan is, as you say, it'll be free in terms 1 and terms 2 as schools adjust, and then beyond that, it will move to a $10 per student per module fee. So, for example, if a student was to want to do the alcohol module as well as, say, the mental health module, that would be $20. So we did a bit of market research with some consultants that we had, and that was considered on the lower end of programs that are offered to schools. So yeah, we're always trying to keep the prices down as much as we can, but we do have to kind of cover a bit of maintenance and hosting for websites and things like that.
Yeah, and it's certainly, I know from the engagements that we do have with schools that if there are fees, that it can be a bit of a barrier. Perhaps that's something that throughout our CDAP program as well, that we're able to support and have a look at what that funding might be able to support if there are some schools out there as well. Okay. Just looking at information that's coming through. Oh, that's Tara that's populating that there, so I won't repeat those. Are there any other questions that we've got from those that are in attendance with us today? And just reminding everybody that is online that we are recording the sessions, and we now have a standalone New South Wales CDAT YouTube channel where you will be able to access the recordings from all of the webinars that we're doing within our series. It's certainly a great opportunity to gently explore what primary prevention programs are out there, particularly targeting young people. We know that that's a large cohort within our CDATs where they have focus. So being able to provide them with the information of where they can get curious and how it is that they can support their communities. It's really valuable for us. So always, as we've been throughout the 2 previous sessions, we're extremely grateful for the time that Matilda Centre have put together to share this information with us and our CDAT. So it's those extra layers of information that provide them with opportunity and thought for the future. Question that's popped up as well. Thanks, Daniel. I might have missed it though. Who delivers the programs in the schools? It's a good question, Dan.
Yeah, so with climate schools and Health for Life as well, they're teacher facilitated programs, but typically the students will run through them individually. So the teacher doesn't really, like that part of the core part of the program is quite set. So we make sure that we're getting those key messages across there. And then we have teacher facilitated activities, the role plays, the worksheets, the discussions. But we do, with climate schools, we do have some other organisations, libraries, youth centres who also facilitate the program. So there is a bit of flexibility. And in the case study that I mentioned as well, they also engage some other students to be those peer supporters to help teachers to facilitate the program. So yeah, primarily teachers, but there is a little bit of flexibility with those sorts of ones. And Jen, did you want to talk to the Illicit project?
Yeah, no, this project is fairly similar. So it's all delivered through online modules that the students just work through independently. And then at the end, there is a teacher component, so they can facilitate a debrief and can run through some of the worksheet activities. So it's just a trained facilitator in a way, but also the students can complete it all individually.
Excellent. That's fabulous. Another question that we have in here, has climate schools generally been replacing older programs or being taken on as a new program within the school?
It's a good question. So climate schools has actually been around for a little while. I think it was 2015 that it was made available publicly to schools. And we do have some schools that have been using it the whole time and love it. I think it really comes down, it differs from school to school, but they have very, teachers are so time poor and there's only so much that they can get into each lesson to tick off that curriculum. So I would say that program is usually the one that they're using to address those outcomes around alcohol and other drugs, rather than using that alongside other programs as well.
And certainly what we do know is if teachers are able to access programs like this where there's minimal additional time that's required from them, they really do embrace. But it's also the flip side of it is also having those teachers involved in the delivery to expand upon their knowledge. We know that teachers are pivotal role models and connections for young people. So the more that we can engage them within that space, it's a greater outcome for everyone. Claudia's asked a question of just wondering how they can get a copy of I can probably answer this one for you, Claudia. Everything will be available on the YouTube channel, and the lovely girls in the Matilda Centre, Tara actually does a lot of the forwarding of links and information post the sessions. So please, if you're struggling to find it, just get in touch with one of us here at the CDAP program, and we'll help you to navigate your way through to the channel, and you can click in on those links. Thank you, Tara. Tara's also answered your question there as well. Do we have any other questions? There's nothing in the Q&A. Our chat's slowing down a little bit. And I always take that as you addressed and answered questions very thoroughly if people don't have extra questions. I was really interested again from the side of the Illicit program when you were talking about the modules. Are there ways that workers like myself are able to link into those modules and do some of those learnings?
That's a new question. I mean, yeah, there's no reason why not. Absolutely. At the moment, the site's just kind of not sitting dormant, but whilst the trial is ongoing in New South Wales, it's hard to really get it in use to avoid contamination of the trial. So yeah, absolutely. If you'd like to complete the modules, I'd happily set you up. I'll register you, and yeah, you can track through them in your own time. Give me some feedback. Always up for a chat about the program.
Fabulous. And the other thing that happens again, it's just that transference of knowledge. What we know, we're then able to share with our CDATs and our members and our other stakeholders and help them to understand the tools that are out there that help them in the work that they do and provide them with a greater understanding of knowledge. Like we say, it's breaking down barriers, it's increasing awareness, it's helping people to have those conversations in areas that perhaps they're not always confident in, and they don't know what they don't know, and they don't know how to find things. So I'm a lover of information, of absorbing it all and sharing it out of, have you heard about this program and do you know about that program? So I'd love, thank you, Jennifer. I'd love to take up that opportunity for you to set me up. Okay, all righty. What we'd also like to just highlight, and thank you, Tara, you have put it into the chat as well, is I've actually been contacted today by a few people, or we're seeing extra registrations come through on Eventbrite for the links for the session for today and for the session in a fortnight. You do receive, everybody that is registered, and we go back and we check it thoroughly. It's almost like a Christmas list of checking it twice. What we do identify is duplicate registrations as well. So we are noticing that there are a few duplicate registrations coming through. If you are struggling to find your link to the session prior to commencement, please check your junk mail or your spam mail, just in case it's gone there. If you are having difficulty still, please reach out. Most of you know how to find me, so just send me an email and we'll ensure that you've got those links. Ladies, is there anything else that you'd like to share or encourage our participants and attendees to know today about pushing forward and how they can expand upon the beautiful work that you already do?
I think I would just say maybe just sign up to our mailing list just so you can stay up to date, to know when that you can access our resources, and yeah, to keep yourself across any other new trials or programs that might be developed if we get some more grant funding. Fingers crossed.
Absolutely. It's all about the mighty dollar and getting more research out there and building upon that evidence and demonstrating that, and hopefully the government skew their little buckets of money towards us in a much more generous way.
That's it.
Fantastic. All righty. If we don't have any more questions, we'll give you 15 to 20 minutes back, or 15 to 10 minutes back of your time. Again, thank you, ladies from the Matilda Centre. Every time we've done a session, we always walk away going, wow, that is just amazing. How can we implement that? How can we put that into place? With our last session coming up in a fortnight, it is, as we can see on our screen, it is about prevention, strong and deadly futures. I'm really, really eager to hear more about that particular program as well. And inroads, I don't know a great deal about that. So it's a great time for all of us to learn more about the Matilda Centre and the fabulous work that you do, and to share those learnings across the platforms with our stakeholders and to the broader community also. Thank you, ladies. Thank you, everybody, for joining us. We love seeing the chats and the questions come through. I'm glad that you are all finding it extremely valuable, and we too are privileged to be a part of that journey with everyone. Have a wonderful afternoon, everybody, and I'll just hand it back to Tara to say the final words, and we'll see you in a fortnight.
Wonderful. Thanks, Gail. I was just going to add, yeah, please do reach out to either Gail or the Matilda Centre email address if you can't find your link, so you're not getting the recordings and handouts, because we definitely want people to be accessing those. We know we've got a few questions. And thanks again, everyone, for joining today. Thanks, everyone. Bye-bye.